From abandoned vehicle removals to working hand-in-hand with government agencies, the private sector, and everything in between, our Virgin Islands administrators are there for you. Stay up to date about your administrators every week on Administrators Corner. New episodes premiere every Tuesday at noon on the Government House Facebook page and throughout the week on the Government Access channel. And we want to hear from you. So email your questions to governmenthouse@go.vi.gov and be sure to put Administrators Corner on the subject line.
Hi, I'm Dr. Ty Hunt-Caesar, Infectious Disease Specialist and the Virgin Islands Department of Health's Medical Director. Many of you may be wondering how the COVID-19 vaccines work and why they are important. The Moderna and Pfizer vaccines we are offering in the Virgin Islands are about 95% effective at preventing severe disease or death. Here are some things you should know. Like all existing vaccines, COVID-19 vaccines are safe. They cannot give someone the infection because these mRNA vaccines do not contain the live virus that causes COVID-19. Despite how they sound, they do not affect or interact with your DNA in any way. The vaccine prepares your body in case you become infected. It teaches your immune system to make antibodies so that once it encounters the virus, it's ready to fight it off. These antibodies stay in your bloodstream ready to protect you in case the virus shows up. The vaccine helps to give you immunity against the virus, and if you get infected, you won't experience severe sickness or death. When enough of us get the COVID-19 vaccine, the virus will have nowhere to go. That will slow the spread in our community. This is what we refer to as herd immunity. That's how we will get closer to ending the pandemic. To learn more about the COVID-19 vaccines, please visit covid19usvi.com/vaccines.
Good afternoon, fellow Virgin Islanders. Welcome to the Government House weekly press briefing and our COVID-19 update for the week of May 10, 2021. I will be providing this week's briefing in the absence of Governor Bryan, who is currently out of the territory. I want to congratulate Governor Bryan and First Lady Yolanda Bryan on their 23rd wedding anniversary, which they celebrated this past weekend. Joining me this afternoon is Health Commissioner Justa Encarnacion to provide the latest on our response to the ongoing health emergency brought about by the COVID-19 global pandemic. We also have present today Department of Planning and Natural Resources Commissioner Jean-Pierre Oriol to provide an update and answer questions regarding the persistent presence of the gaseous odor on St. Croix this past week. Before we go to Commissioner Encarnacion this afternoon, I would like to express my heartfelt condolences to the family and loved ones of 16-year-old Kimani Perdomo, who was murdered Sunday morning in the John F. Kennedy housing community. This is certainly a tragic occurrence, particularly on Mother's Day. I pray that the family finds comfort in this time of grief, and we ask that if you have any knowledge that can lead to the apprehension of the individuals that perpetrated this crime, please come forward and share what you know with the Virgin Islands Police Department. As always, you can also provide information through the national tip line at Crime Stoppers, and that is 1-800-222-8477, 1-800-222-8477. Please help us bring the murderer to justice. And now I'm pleased to turn to Commissioner Encarnacion for her presentation. Commissioner, good afternoon.
Good afternoon, Lieutenant Governor, and thank you. Good afternoon to everyone. As of May 8th, 2021, the Department of Health has tested a total of 106,018 persons, of which 3,223 individuals have tested positive, and 102,795 individuals have tested negative. There are currently 94 active cases in the territory, 16 on St. Croix, 77 on St. Thomas, and 1 on St. John. 3,102 cases have recovered, with 27 fatalities related to COVID-19. From our hospitals, the Governor Wong F. Louis Hospital and Medical Center reports no COVID-positive cases. Great news. The Schneider Regional Medical Center reports 3 COVID-19 cases, of which none are vented. Our weekly percent positivity rate is 3.33. This is a dramatic uptick from 1.86 last week. We have seen a major increase in cases in St. Thomas. You must do your part. The most recent surge seen on St. Thomas is among unvaccinated individuals. I will repeat that. Unvaccinated individuals, and was determined to be a cluster-related incident. And the more widespread disease is likely due to recent private functions and parties organized against the governor's orders. We are all feeling the impact of what now seems to be a chronic episode, the COVID-19 pandemic. I know the itch to vet is alive, but please take a moment and look at the trends. We are able to keep our hospitalizations down, with many of you adhering to the guidance and the use of the monoclonal antibody as a medical countermeasure used more frequently today. It's unfortunate that we are still seeing this type of trend since the vaccine is widely available and easily accessible. Let's all do our part. COVID-19 is still here. It's just a reminder. Wear your mask, avoid mass gatherings, and stay home when you're sick. We are still offering pop-up testing and also testing individuals who are sick or have been exposed. Our surveillance efforts continue as our epidemiology team works to conduct contact tracing and investigation. Our epidemiology hotline remains open 7 days a week from 8 a.m. to 10 p.m. for callers to report suspected cases of COVID-19. The numbers in St. Croix 340-712-6299. St. Thomas St. John 340-776-1519. And if by chance one of the numbers is busy, you can leave a message, or you can simply call the other number one area will get the message to the other area. Our testing, you can pre-register for testing for pop-up testing online at COVID-19 USVI.com/testing. And the events are St. Thomas at Home Depot, Tuesday, May 11th from 1 p.m. to 3 p.m., St. Thomas at the Fort Christian parking lot, Thursday, May 13th from 1 p.m. to 3 p.m., St. Croix at the Canigata Ballpark, the Rec Center. That's Tuesday, May 11th, tomorrow from 10 a.m. to 12 p.m., and St. Croix location and time will be announced before Thursday, May 13th. St. John at the VI Port Authority Gravel Yard, which is Wednesday, May 12th from 1 p.m. to 4 p.m. We are still pushing hard to reach our goal of vaccinating 50,000 unique individuals by July 1st. So far, 38,165 first doses have been administered and 29,033 second doses, with a cumulative number of 67,198 total doses administered. We are 11,835 first doses away from reaching our goal, which brings us closer to reaching herd immunity. We appreciate the community's willingness to get vaccinated and help us end the COVID-19 pandemic. My apologies. Everyone age 16 and older can be vaccinated. We are working to expand vaccinations to children ages 12 to 15 with the Pfizer vaccine in the very near future after the new Advisory Committee on Immunization Practices, or ACIP, recommendation is updated with a current emergency use authorization, or you might hear the term EUA frequently. We are offering all three vaccines, Pfizer, Moderna, and Johnson & Johnson in the territory. To schedule an appointment to get vaccinated, please call 340-777-8227 or visit us online, where you can also schedule your own appointment at covid19usvi.com/vaccines. The VI have not experienced any severe adverse reactions or effects from any of the three vaccines, including the nationally reported adverse reaction from the Johnson & Johnson vaccine. We are making it easier to get vaccinated by bringing the COVID-19 vaccines to your community and other busy areas like businesses across the territory. This week, we will be in housing communities, sharing information, providing education, and answering the questions and concerns about the vaccines. You can also be signed up when you see the team. While being vaccinated is not a requirement for travel, it certainly does protect you while flying and also while on vacation. It also makes traveling easier. Our current travel requirements can be found online at USVI.com. Some good news: a virtual vaccine passport is currently being developed for use in public and for travel in lieu of testing. Let me explain what I said in terms of in the public. If we have a FET like we did for the Department of Tourism, you can actually use the virtual vaccine passport as a link to getting into those kind of FETs. Until we have activated the virtual vaccine passport, it is important to remember that you will need a valid negative PCR or positive antibody test to be uploaded onto the travel portal. Other reminders: today, the community vaccination centers are open at their new location. They are no longer at the University of the Virgin Islands campuses. The St. Croix Community Vaccination Center is now at the Nissan Center on St. Croix, which is in La Grande Princess, adjacent to the Honda dealership and the paint shop, on the same side of the street as Food Town. On St. Thomas, the Community Vaccination Center is now located at the Community Health Clinic on the second floor of the Schneider Regional Medical Center. If you have an appointment to get vaccinated, please try your best to make the appointment. If you can schedule an appointment, you can actually walk in, but please try to get there early. To keep up with the latest information, please visit the United Virgin Islands Department of Health Facebook page or our website, www.covid19usvi.com, and for COVID-19 health information alerts, text COVID-19 USVI to 888-777. Thank you and be safe. Thank you, Lieutenant Governor.
Thank you, Commissioner Encarnacion. Just a quick question. I took the Johnson vaccine, and I know we halted the use of it in the territory. But since that time, persons have been asking me about it because it was convenient for them to take one shot. So I just want to be clear, we are going to resume the use of the Johnson?
We have resumed the use. We're using it, we have actually one pharmacy that is using it as well, and that's Kmart.
Okay.
And we're using it, and not only we're going to extend it, but first we're actually, as we agreed upon, we are going to be going into the homes, the nursing homes, for those that are unable to come to the community vaccine centers.
Good. Thank you so very much.
My pleasure.
Now, for some of you who have been receiving your stimulus checks, and for those who might not have, we're going to give a little update on the economic front. The Department of Finance last week mailed the first batch of American Rescue Plan stimulus checks. Those checks averaged approximately $2,500 per household. This week, a second batch of at least 10,000 checks will be issued once again. The administration is on track to issue all checks from this latest round of stimulus payments within the month of May. I also want to take this opportunity to thank Assistant Commissioner Clarina Modeste Elliott, who has been filling in as the Acting Commissioner of Finance since last October. She has done a great job steering the department and performing her normal duties. I also wish to thank her personally for her service on the Banking Board, which I chair. We thank her for her dedication to the people of this territory and for the wonderful work. Today, Commissioner of Finance nominee Bosede Bruce begins her service at the Department of Finance. We're excited to add her to the team, and we wish her well. We also wish to remind you that the Emergency Rental Assistance Program is currently taking applications for individuals and families who have been financially impacted by COVID-19 and need assistance in paying rent or utilities. For more information on how to receive assistance under the program, please visit www.vihfa.gov/ERAP or contact the Virgin Islands Housing Authority at 340-772-4432 or 340-777-4432. In other COVID-related matters, there has been quite a spirited dialogue in the last few days regarding the manner in which high school graduations are to be conducted. I want to commend the students who have bravely stepped up to let their voices be heard in this regard. They are already demonstrating a willingness to eventually assume the mantle of leadership, and that is most welcome. We must support our students whenever they speak out about the issues that are important to them or which affect the quality of life in our community. Now, last year, the Department of Education was forced to react quickly to the outbreak of the COVID-19 virus and ultimately held fully virtual commencement exercises for all of our graduating public school seniors. Considering the circumstances, those were successful events and salvaged the graduating experience for our students. At that time, it was impossible to predict what the future held in store. While we have made considerable progress in combating the unabated spread of the COVID-19 virus here in the territory, we are still very much in the midst of a deadly pandemic. The Department of Education and the faculty of our high schools would have loved to host traditional in-person graduations this year, but that is simply not possible. Any attempt to accommodate an in-person graduation with students, faculty, and guests would immediately violate the guidelines currently imposed by the Department of Health by creating a gathering of hundreds of people, and more importantly, put the health and safety of our people at risk. Such a large assembly of persons, many of whom would be likely unvaccinated, creates an unacceptable level of risk and could quickly lead to a setback in our diligent progress against the virus. Instead, the Department of Education has planned the graduation ceremonies that are primarily virtual, but take one step closer to normalcy by allowing students to experience the most cherished elements of traditional graduation. Students will celebrate by walking across the stage in cap and gown with pomp and circumstance playing, having their immediate family in attendance to witness that occasion, and getting a professional photo holding a diploma. What will not take place is the accommodation of in-person audiences or congregating at the ceremonies. All 4 public high schools throughout the territory will conduct their commencement exercises in this manner. The only slight variation will be Charlotte O'Malley High School, which cannot accommodate a similar drive-through stage as is being erected at other high schools. Their graduation will be a walk-through event instead. However, it will adhere to the same health protocols as the other 3 schools. The principals and graduating committees at each of our public high schools have put significant thought into the conduct of these events. They have planned spectacular events that will honor the achievement of our graduating seniors. We thank them for their creativity and ingenuity in these trying times. We must be mindful that these are not normal times. We have been effective in our management of the virus because we have made prudent decisions when and where necessary. We cannot afford to abandon that same level of prudence at this time when we're making such great progress towards restoring normalcy. In non-COVID matters, this afternoon the island of St. Croix has been confronted in recent weeks with gaseous emissions in the atmosphere that are at best a nuisance that is degrading our enjoyment and quality of life, but which at worst present a clear and present risk to the health of our residents. Several agencies have spent the weekend tirelessly pursuing the source of these emissions. I must say that I'm impressed with the technical capacity possessed by our Virgin Islands Civil Support Team, the Virgin Islands Fire Service Hazmat, and the DPNR, Department of Planning and Natural Resources, Environmental Protection Division. Working in concert with the personnel provided by the Federal Environmental Protection Association, I do believe we possess the resources to properly safeguard the health of the St. Croix community. I believe we need to work harder at deploying those resources in a timely fashion when we have incidents as we have been having. At this point, I will ask Commissioner Oriole to provide an update on the ongoing efforts. And I would also add that we have met several times this weekend discussing the findings at the refinery and other matters of preparation. Commissioner Oriole, please update the territory on your report.
Thank you, Lieutenant Governor, and good afternoon to the people of the Virgin Islands. As a result of the odor complaints received in the late weeks of April, but becoming more steady beginning on May 5th, we received more constituent calls and unable to find a source. DPNR requested the additional assistance from the United States Environmental Protection Agency, and Governor Bryan activated the Unified Command Team. That command team is comprised of the Virgin Islands National Guard's Civil Support Team, the VI Fire Service, Hazmat Team, DPNR personnel, and provided assistance from the US EPA. The Unified Command Team identified levels of sulfur dioxide in the atmosphere when conducting preliminary testing on Saturday, May 8th, however, did not identify elevated levels at areas adjacent along the industrial complex. On Sunday, scheduled testing inside the refinery did not show any elevated readings. Both the CST and the fire department's hazmat team will continue monitoring and will mobilize and conduct hotspot checks in the community based on complaints. In addition, additional monitoring resources provided by the US EPA which have been mobilized throughout the weekend into today, will also be deployed. The team will continue to conduct active monitoring, will mobilize the newly acquired monitoring devices and equipment to ID the elevated chemical components in the atmosphere with the goal of identifying the source once and for all. Thank you, LT.
Thank you, Commissioner Oriol. In closing this afternoon, the month of May is a time when we recognize a variety of civil servants in the public sector for the work that they do to keep our society on track. This week we are recognizing National Police Week, as we did last week, National Nurses Week. These two professions have been front and center in our community's daily challenges. I wish to thank our nurses and our police officers for their dedication and commitment to public service. Finally, this week, we recognize National Hurricane Preparedness Week. By now, we should all have started our preparedness routines and begin to put our affairs in order in preparation for the Atlantic hurricane season. It is important to have a hurricane preparedness supply kit that includes batteries, first aid supplies, non-perishable foods, water, and copies of your important documents. The Virgin Islands Territorial Emergency Management Agency's website has a wealth of information on the items that you may need to build these kits and other helpful information to help you prepare in the event of a hurricane or other natural disaster. Please also visit the website of the Office of the Lieutenant Governor, which provides guidance that will be helpful in protecting your property and making a successful insurance claim where that becomes necessary. Remember, you cannot procure insurance after a storm has been named. We live in a time when changes to the climate make the behaviors of these storms more difficult to predict. That is why it is all the more important to make a plan and to discuss it with your family, not just during hurricane season. Before a hurricane strikes, it is important to have a conversation with your family about where you will go and what you will do for shelter if needed. Make sure you service your generator, if you have one, in the event that there is a loss of power for an extended period of time. Don't forget to visit vitima.vi.gov for more information. At this point, I will entertain any questions that may be presented by the media. I believe that we are already joined online by 3 media outlets, and we will begin with Ms. Suzanne Carlson from the Virgin Islands Daily News. Ms. Carlson, if you can hear me, please go ahead with your question. Ms. Carlson, if you can hear me, please go ahead with your question for the panel. I'm not hearing anything from Ms. Carlson. At this point, we will move on, and we will entertain a question from Lasiba Knight of the St. Croix Avis. Ms. Knight, can you hear me? Is it possible that we answered every question that the media could have? That would be good. Ladies and gentlemen, give us just a minute. I think we may be having some technical issues with the media online. Okay, there's some sound. Good afternoon, Lasiba Knight, St. Croix Avis.
Can I give some more information in regards of the cluster that occurred that has caused the increased number of cases in St. Thomas? Is that the question?
I think the question is it correct that the numbers reflect a church service? I think I heard that at the end.
Yes, actually, it did reflect coming from a church service. And just to let you know, our epidemiology team has actually been on it right away. And so we've tested, I would say, a good 50% or more of the congregation. We will continue to do so as needed. It's over 100. To say exact, we just started to resurface the Johnson & Johnson. Prior to holding or putting it on pause, we had administered over 100, 120, around that number. I don't have those numbers right in front of me, but I could get those to you, Lesiba, if you need it.
Thank you so much. Then I just have one question for the Commissioner of DPNR, Mr. Oriol.
Thank you. Go right ahead.
So thank you for the question. DPNR doesn't have any monitors of its own itself at this point in time. However, when there is an odor complaint or an investigation, what DPNR does is request the raw data from any of the facilities that they have permits with. And so within the submission of the data, what we're looking for is any anomalies within a 3-hour average that is turned over, and that's the direct report outs from the instrumentation itself.
Okay. Thank you so much. I appreciate that. And just I didn't hear Suzanne earlier. Maybe she's still on the line. Thanks so much for your time. I appreciate it.
Thank you, Mr. Knight. We'll try again for Ms. Carlson of the Virgin Islands Daily News. Good afternoon. Yes, we can hear you now.
So I couldn't hear the question.
On the system.
No, say that again. If Lime Tree Bay is operating.
It's a follow-up with regard to the response of not having the monitors.
Yes.
Her question is, are they on a system with regard to our accepting their data that they report?
Yes, they are. So they report directly into a database that feeds into the US EPA's clean air programs, of which the Virgin Islands has a delegated program for. And so those logs, all of the data that comes in for the monitored compounds, again, we request the raw data, what's that, the emissions for those 3-hour cycles, because that's how it has to be reported into the database for the US EPA.
Okay, it's very difficult for me to hear, so I'll try to train and understand you. So, but they were operating 5 union air monitors. So what air monitoring have they been doing?
So again, what DPNR, we didn't state we were doing our own air monitoring prior to. Since the department has requested additional support, we've been provided air monitoring equipment from the CST as well as the US EPA. All of those assets have been deployed, as well as the VI Fire Service Hazmat team. And the department is working also on having the permanent monitors installed in the locations that they were previously installed in under operation of Hovenza.
refinery restarted and when residents started making complaints, was there any third-party independent air monitoring not being done by Lime Tree?
No, there's no third-party independent that was doing any monitoring.
Okay. Lieutenant Governor, I've been hearing just consistent complaints about the cadastral office, the recorder of deeds. There was a shutdown and then a backlog, and I'm still hearing complaints from people saying that $1 million deals are sitting on a table somewhere waiting for action, and revenue is not being collected on these real estate transactions. Do you have any update on that?
Certainly. So the question is about, in case it wasn't clear, the experience that we've been having at the Recorder of Deeds offices in both districts with some delay in the filing of documents. So I'll take each district separately. So in the case of the St. Thomas St. John district and the St. Croix district, we had a computer issue, a cybersecurity breach at some point in the month of April. And that affected all of our divisions. It also affected some of the other government agencies, although many of them have not said anything. But in our case, it set us back in the Record of Deeds section and in the Corporations and Trademark division. So just as soon as we were, and that was significant, and just as soon as we were getting over that, we had a COVID outbreak in our Niski Center offices where the Record of Deeds is located, and that required a complete shutdown of that office. It included cadastral, the Office of the Tax Collector, the Office of the Tax Assessor, the Record of Deeds, the geographical and spatial systems. And they were closed because employees had to be quarantined for, in some instances, as much as 8 days. And that further set us back in the St. Thomas St. John district. I am pleased to say that the employees, even in those instances, took work home with them. When the offices, we had to get the offices thoroughly cleaned and sanitized, and when they came back, they were working even weekends to bring recordings up to date. So that in the St. Thomas St. John district, we were able to address the backlog effectively by the end of last week. In the St. Croix district, although we did not have a COVID outbreak, if you may note in your own newspaper, you've talked about the expansion of economic activity in St. Croix and the increase in number of sales. Our staff in the Office of the Record of Deeds in St. Croix is a small staff, and what we've done is we had our computer systems install another stamping machine. We reassigned staff from our offices in Frederiksted, and one employee from our tax collector office in Sunny Isles to beef up the staff of the Record of Deeds on the St. Croix side, and we expect to have that backlog addressed by the end of this week. That's my response. Thank you.
I'm going to be honest, I couldn't hear any of that. I'll listen to the video later on, and I'll follow up with Ms. Solomon if we have any other questions. But
no problem.
Today is particularly bad. I can't hear anything, so I'll let you go. Thank you very much.
Thank you. Have a good day. Are there any other questions? So if not, we thank you so very much. We continue to monitor and continue to test for the COVID-19 updates. We encourage our residents to get the vaccine and to do whatever the health department, the protocols that have been put in place with regard to hygiene, social distancing, etc. We recognize that this has been a long experience. It has been a traumatizing experience for the families who have lost family members, and it's been exhausting for us to change the way that we live, the touching, the hugging, etc. But we have to continue if we expect to come back to any degree of normalcy. So we thank you for supporting our efforts, and we will continue to update you with regard to the situation at Lime Tree, and the monitoring. In our case, I had to close my offices at Frederickstead at least one day because of the odors, and we are all very much concerned to do as much as we can, everything within our power, to improve the quality of life for the residents in St. John, in St. Croix, and to take whatever actions are necessary to protect health and safety. Thank you also very much for joining us this afternoon. Thank you, Commissioner Encarnacion and Commissioner Oriol. Have a wonderful day.